for joining us for today's webinar. We spread our awareness about rabies, which is fatal. All you know, doctor, but can be avoided once appropriately vaccinated. This is an initiative from Kedla Pharmaceuticals through its innovation to serve the society and mankind. Today's topic is dose reduction strategy in rabies management and role of the novel vaccines. Dear doctor, rabies is the world's first 3-dose anti-rabies vaccines. Such rabies has successfully completed 1 year with more than 40,000 animal bite victims being vaccinated. Not only this, but also 100% compliances was recorded and no cause of ADR registered. With this, I welcome from core of my heart and I honor to introduce today's our speaker, Dr. Anurag Agarwal sir. He is very famous in Ghaziabad city. Every participant, I expect that knowing him, his name is enough in Ghaziabad city. He is MD physician and his association is for last more than 20 years and he is working too. Now I will request Dr. Anurag Agarwal sir. Now your time start now, sir.
Thank you, sir. Thank you. Namaskar. Good evening, everyone. I am Dr. Anurag Agarwal, and today I will speak about rabies and novel vaccine, the three rabies. The most important thing is, as we all know, that rabies is a very famous zoonotic disease and which is 100% fatal. अब की रेबीज एक ऐसी बीमारी है जो कि जानवर के द्वारा हमारे पास होती है और जो कि इसका कोई क्योर नहीं है.
Just sir, hold on, sir. Parul, can you convey the message?
Sorry, sir, I'm not able to hear. क्या बोल रहे हैं?
Not running.
अच्छा, slides are not running. Okay, I'll come. And okay, I'll call.
मैम एक बार वहां से थोड़ा देख लीजिएगा.
हाँ,
मैं वहीं से कर रहा हूँ. Support team will also help us in this regard.
जी.
Support team, please facilitate the slide. अपने स्लाइड सुमन डॉक्टर साहब के हैंड ओवर किया क्यों आप इन बिटवीन सॉरी फॉर इनकन्वीनियंस
कर दिया. इनके चैम्बर में देखो प्रॉब्लम आ रहा है, नेट का इशू आ रहा है.
ओके, कोई इशू नहीं है. इन बिटवीन सॉरी फॉर इनकन्वीनियंस.
Yes, sir. I'll share the slide from my end because there is some technical issue.
Okay. Go ahead, please.
Okay. Sir, my slides are visible?
Yeah, ma'am, visible.
Yes.
Okay.
Good. Thank you, Parul. बहुत धन्यवाद आपको. Now request Dr. Anurag Agarwal sir, please sir.
Continue. Yes, sir. Right now we are having almost 114 participants with us, sir. That is a huge number.
That's great. That's
good number.
Sir, over to you, sir. थोड़ा स्लाइड मूव करते रहना.
हाँ, yes sir.
Okay.
Dr. Anurag, he is on mute. That's why we are not able to hear.
No, 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 ma'am, no, ma'am. Am I audible to all? Am I audible to all? Am I audible?
Yes, yes, now audible, sir.
Yeah, audible, sir. Audible, sir.
Yes.
Okay, sir. Good evening, everyone. And today's topic is dosage reduction in the rabies management, the role of a novel vaccine. As we all know that rabies is caused by a rabies virus, which is 100% fatal. It is our utmost duty to save each and every life from the death of rabies, from the jaw of rabies. Rabies एक ऐसी बीमारी है जिसका कोई क्योर नहीं होगा, and it is our duty to save each and every life from it, from the jaws of it, because it is a disease which can be prevented, but it cannot be cured. Five structural proteins, which are namely G protein, coating the glycoprotein, N protein, nucleoprotein, phosphoprotein component, M protein, and L protein. Of all these components, the G protein is a major antigen which plays a major important role in the formation of the neutralizing antibody against the rabies virus. Next, globally estimated that almost 59 to 60,000 deaths per year, as estimated by the WHO, that almost 59 to 60,000 deaths per year are caused by rabies, and of which almost 1/3 of the rabies deaths per year occur in India, and in of which 91% of these deaths occur in the rural areas. I would like to again make it clear that per year 60,000, almost 60,000 deaths are caused by rabies. Of the entire world, 1/3 of the deaths are caused in India, and of the total deaths in India, 90% rural areas में है. So it is our duty to save it fully. And rabies is a 100% fatal disease, which is 100% vaccine preventable. मतलब कि वैक्सीन से आप उसे 100% नकार सकते हैं. And that is proven now and previously also in the various trials, and we are looking for the various rabies vaccine in the market for the same. When I was even not born, we had heard that कुत्ता काटता है तो 14 इंजेक्शन लगते हैं, and even my teachers used to say पहले तो 30 इंजेक्शन लगा करते थे पेट में. And there comes the story of a neural vaccine, which is a live attenuated vaccine, which is developed from the spinal cord of the nervous tissue of the rabies virus. Now, these were the non-standardized preparation, which needed almost more than 30 injections per time. If the rabies virus is, or if the rabies virus suspected get bitten by bitten to anybody, then comes the inactivated vaccine, which contains the brain tissue almost up to 10%, and it was the story of 1910 and 1911, where minimal neural lipid component was there, which requires 14 injections of 0.5 ml daily. And then the era came in 1976 when the cell culture vaccines came in the market, which were standardized, having standardized immunogenicity, and they were lyophilized. They were lyophilized, so their heat stability and their shelf life was also increased. And these cell culture vaccines required very minimum amount of dosage, 2.5 injection unit. And they were having only 0.5 to 1 ml of inoculation single. So till now they required 5 injections for each episode of the rabies dose to be given. Whenever a rabies virus or suspected rabies virus bites anybody or scratches or comes in contact with any suspected person, comes in contact with such rabid animal. So these 5 vaccines used to be given, and these were the number, as the number of inoculations and the vaccine increased, that their compliance is a very big question in our mind. As the number of injections required is more, the cost more. The requirement for the health facility to understand is more. The pain at the site of injection is definitely there, especially Indians who don't even want to take the injection of insulin for treating the diabetes. How can we hope that they can even go and get the rabies vaccine? And moreover, for 5 times, once it is bitten by the rabid animal or suspected rabid animal. So there was definite all-time need of reducing the number of injections which a person should be inoculated to save him or her from rabies. Moreover, the vaccine should be of such type which has very little number of side effects. The current rabies cell vaccine are cell cultured vaccine. They are inactivated vaccines are already more than 50 years old technology, which have inconsistent potency. In they are liquid dried preparation. They have little stability, or they had short supply, and moreover, because of being neural dried vaccine, they have lots of adverse effects. Moreover, there is a still with the available vaccine which is still available in the market, which require 5 inoculations. They have decreased compliance because of more number of inoculations required beyond the 3 injections. As the non-compliance is a very major factor, as has been seen that for the 4th and 5th injection, the compliance rate definitely decreases. Meeting the unmet medical need, there is an introduction of novel rabies vaccine with a simple and shorter regimen, and that is Rabies. Rabies is a recombinant rabies G protein vaccine which is developed and it is available in the market. It is the first viral protein subunit vaccine which is prepared by the virus particle platform technology, and it requires only 3 doses which given by intramuscular regimen on 0, 3, and 7 days. It has better compliance due to easy to flow regimen and less number of visits to the doctor or the healthcare facilities. Moreover, convenience is there, ready to use, no reconstitution is needed. And that's why it is easy to administer also. This VLP technology is a very important one. The VLP stands for virus-like particle. G protein is the difficult part to stabilize, and G protein isolation virus-like particles are protein complexes which exist as nanoparticles. These nanoparticles are tiny particles which are of very minute size. They are similar to the native virus, but they do not contain the viral genome. They cannot replicate, but they mimic the viral antigenicity without being pathogenic. मतलब ये हुआ कि ये VLP लाइक जो प्रोटीन है, इसके पास वायरस का जीनोम नहीं है, परंतु शक्ल सूरत में वायरस जैसा है। और उसकी वजह से अगर हम इसको छोटी मात्रा में इनोकुलेट करें तो ये बॉडी के अंदर वायरस के का रिस्पॉन्स बनाती है। सेल्यूलर या ह्यूमरल एंटीबॉडीज जो होते हैं दोनों कैंसर में स्टिमुलेट होते हैं एंड same thing has been clearly published in a which is clearly meant for only for the a novel recombinant rabies G protein vaccine, Rabies, a VLP based rabies vaccine in the international control of rabies in India. This was original article which was clearly published in 2021 itself.
Next slide, please.
Two trials clearly had two the dosage or the 3 doses. The aim of the thing was to decrease the number of dose, number of inoculation, so that patients can be saved from the repeated visits to the doctor or healthcare facility, besides not compromising the efficacy or seroconversion rate. So, and it was found that after inoculation of the 3 doses, the results of the phase 2 trials clearly showed that at inoculation of 3 doses resulted in the results which were not inferior, they were at par with the results of 5-day vaccines which were available in the market, 5 doses vaccine which were till now available in the market. Here and each inoculation group was compared with the standardized group where 5 inoculations were required. The seroprotection rate was checked for at day 14, day 42, day 90, day 180, and day 270. And as is clearly shown in the bar graph, that seroprotection rate of the till now available Rabipur vaccine has almost the less number of the less number of inoculations with 3 rabies, the same result in seroprotection as the given by the available Rabipur vaccine. In the phase 3 clinical trial, safety and was in the phase 3 study to evaluate immunogenicity and safety of rabies G protein vaccine administered as a simulated post-exposure immunization in healthy volunteers was compared in a randomized comparative controlled multicentric study wherein more than almost 800 patients were taken, healthy subjects were taken, and they were randomized in 2:1 group. The test group was given 037 regimen and the comparative reference group was given the 5 inoculation of the reference Rabipur 037, 14 and 18.
Arul, next slide, please.
Objective was to demonstrate the non-inferiority of the test vaccine to the comparative vaccine. And the primary objective was the subjects with seroprotection at 14 days after the first dose. And seroprotection was defined that RNA virus antibody titer of more than 0.5 international unit per ml, with the secondary objective of subject with seroprotection at 42 days after the first dose of the test vaccine. And the protection was defined as protection obtained by the vaccination. And it was clearly found that seroprotection rate in the test group where only 3 inoculations were given as compared to the previous known vaccine was not inferior, it was far better. 99.24% was far better than 97.72% at 14 days. Moreover, when the seroprotection rate was compared on day 42, almost the same result was obtained. The minimal difference of 1.52% was not inferior, and was consistent with this seroprotection rate was observed for entire range of subjects without difference in the male or female sex or age group of inoculation or any comorbid conditions. Number of inoculations. However, as far as the safety is concerned, there were less number of adverse effects in the test vaccine, which is the 3 rabies with 3 inoculations, and the most common adverse is localized pain. The complications were redness or swelling. Few percentage of patients received fever, ear pain, headache, urticaria, joint pain, and nausea. What is the percentage of the side effects? These were far below the available vaccine in the market.
Arul, थोड़ा slide change करो ना. Yes.
Almost better outcome. It is not increasing the existing vaccine in the market. It is giving the same rate of seroprotection. It is requiring less number of inoculation, less number of healthcare visits, and less pain at the site of injection. Less at the site of injection or administration anaphylactic shocks. No adverse reaction, localized site of reaction, adverse effects were noted. So at the end of the study, we could have this vaccine adverse effect and it was found to be safe and immunogenic as compared to the 5 doses of the WHO pre-qualified vaccine. So here the story is not ending. This rabies vaccine, the novel vaccine, went hand in hand with the doctors also. And so it won the various prizes also. Pharma Innovation of the Year by the Economic Times, the Golden Globe Tigers Award of Malaysia as the Innovation Product of the Year, which is was a great tribute to its researchers. Thank you. So at the end, I would like to say that now a 3-dose vaccine is available in the market, which requires less visit to the doctor. It is cost effective, good seroprotection rate, and high safety profile with less number of side effects, no incidence of anaphylactic reactions or adverse effects. I would like to conclude that a better vaccine is available in the market. We should go for it. As my personal experience, I've been saying that the last 2 years, I myself is using in my clinic, and it's wonderful one. The response rate and the compliance is also better because of less number of inoculation. When we sit in the clinic and guide, you are required to go at 5 vaccines. Earlier, it used to be 14 and 30 vaccines doses. Patient used to run up. Now it has come down to 3. A great salute to the initial thank you.
Sir, last words, I think the message is missing because you are not audible frequently.
Hello, sir.
Sir,
Hello.
hello.
Suman, I think Dr. Saab is not audible. Okay, no issue at all. No issue.
The main is clinic and the signal problem is very difficult.
So
5 dose versus 3 dose. Not only this, but also they have conveyed the message. I'm audible, Suman.
Yeah, sir. Audible, sir. Audible, sir. Audible, sir. Yeah, audible.
आपको भी नहीं आ रहा है?
Yeah, audible, sir. Audible, sir.
Hello.
Audible, sir.
Hello.
Hello. Yeah,
आवाज
fully
नहीं आ रहा है?
audible, sir. Audible, sir. Hello.
Hello.
Yeah. Yeah, sir. Audible, sir.
आवाज नहीं आ रहा है?
hello.
Yeah, आ रहा सर, आ रहा सर.
पारुल, आपको आवाज आ रहा है? Okay.
Sir, audible.
So, I think Anurag Agarwal sir is here, but not audible due to some technical issue. Sorry for inconvenience to all participants, but just I am taking the 2-3 advantage things which Dr. Saab has shared in this webinar, that our seroprotection is at par as compared to 5 dose versus 3 dose. Second, sir, now I'm audible, sir.
Yeah,
Yes, sir.
audible, sir. Audible, sir.
Suman, you are also not audible, I think. So, sir, I'm just taking 3-4 points which you have conveyed to all delegates. My voice is going to all delegates, I think. you have conveyed that price factor is also at par if any doctor, any important delegates will compare with this 5 dose versus 3 dose. Third, you have also conveyed that trial have also been done with 3 dose versus 5 dose. Seroprotection has maintained, and we can say that at par. I will also convey that day one, since we have launched these therapies, Dr. Sahab has started using day out, day in. Only he is using now therapies. So thank you very much from core of my heart, Dr. Sahab, for giving your valuable time with us. I will request all delegates, if you are having any query, feel free to ask.
Yes, sir. Yes, sir. I'll share the question, sir. Anyways, the way sir presented the slides, it was very beautifully. सबको बहुत ही क्लियर और बहुत अच्छे से समझ में आ रहा था. सर ने अपना पर्सनल एक्सपीरियंस भी शेयर किया. सर ने पूरा स्टडी के बारे में, सेरो प्रोटेक्शन के बारे में जितना बताया, इट वाज कमेंडेबल सर. और द वे ही प्राउडली मतलब कैडला के बारे में, हमारे प्रोडक्ट के बारे में, द वे ही एक्सप्लेन, उससे पता लगता है कि किस तरीके से ही मतलब ही सपोर्टिंग अस, एंड किस तरीके से 5 डोज के मतलब सर ने स्टार्ट किया कि स्टार्टिंग फ्रॉम 28 डेज, फिर उसके बाद वो 15 दिन की, 7 डेज, इस तरीके से सर ने जिसने बताया, इट वाज वेरी ब्यूटीफुली एक्सप्लेन बाय अनुराग सर. देयर आर फ्यू क्वेश्चन सर. एक चीज तो ये है कि व्हाट आर द साइंस एंड सिम्टम्स ऑफ रेबीज इन ह्यूमन, ये क्वेश्चन एक डॉक्टर ने पूछा है. अगर इफ आई एम ऑडिबल, प्लीज ट्राई, मतलब बता सकते हैं कैसे इनिशियल क्या साइंस होते हैं देखने से.
Sir, rabies is a zoonotic disease, is just like any other viral illness. Will be associated with in the initial stages, will be associated with fever and lassitude and letharginess and weakness. The most common symptom is the hydrophobia and aerophobia, which are the later stage signs. So if the most important thing is the history. The history will only tell us that we have to be very much careful about, and the history of being bitten or in contact with the rabid animal or suspected rabid animal, being coming in contact with the saliva or the secretions of the rabid animal, then we should go for the inoculation. That is very important. And nobody has treated a rabid animal, rabies case, and we have only heard of it. And if it is there, if you ever encounter a patient of aerophagia or
Good, sir. Good, sir.
so the initial symptoms will be just like the viral-like illness: fever, lassitude, letharginess, severe weakness, pain all over, associated with aerophobia and hydrophobia. So, besides, as the symptoms of involvement of the other system will increase, then the neurological symptom of confusion, delirium, and other symptoms will come. And as more and more system will involve, then multi-system organ involvement will come, and the symptom pertaining to that will start coming.
Thank you, sir. Thank you for addressing the question.
Most important point lies in the history. We have to be careful about the history.
Rightly said, sir. And sir, one thing I would like to appreciate that right now we are having 116 participants for this webinar. So it is a huge round of applause for you as well as Anand sir, that many participants are here to listen to you, and the way you explained is very well, sir. In my chat box also, lots of the queries which I'm getting, it is like, okay, Dr. Anurag Agarwal, we have understood. Matlab, they are appreciating that they are understanding the thing. The way you have explained, they are appreciating those things in the comment box. So kudos to you, sir, and thank you so much for being part of this Rabies webinar. And you have highlighted the awards also. So thank you, sir. Keep supporting. And to all the delegates who have been here, have given your valuable time. Thank you from a Cadila family, from all the Cadilians. We are thanking you for being a part of Rabies webinar. Anand sir, over to you.
Yes. No, I'm audible. So from core of my heart, Dr. Anurag Agarwal sir, I say thank you, sir, not only from my side, but also entire Kedla team side, sir, entire function team, sir, entire PMT team, sir, entire higher management team, sir. This is my message to you, sir. I also pay thanks to all delegates who have joined with this meeting, today's webinar. Although you don't require Dr. slide.
Yes, yes, that
You,
was, yes, correct, sir. I have also seen, sir doesn't need any slide. He was very well
absolutely, absolutely.
explaining. That was
The
so
way we
good,
have,
sir.
yes, the
Yes,
way we have gone through the slide, I think I experienced that there is no requirement of the
no
slide.
need, correct. Yes,
Although we have done these things, sir, say thanks to Kidla team, PMT
Thank you,
team
sir.
once
Thank you.
again, Dr.
yes,
Anurag
yes,
Agarwal, special thanks, and all delegates, especially all participants who have joined with this meeting. Say thanks. Support team also thanks.
yes,
Thank
sir.
you, Suman and Ghaziabad entire team on
Yes, sir.
behalf of
Thank you so
Kidla
much.
and management team.
Yes, sir.
Thanks a lot.
Thank you, sir. Thank you, sir.
Thank you,
Very
ma'am.
soon, sir, going to
Thank you,
connect
sir.
with you, Dr. Saab.
Yes, sir.
Okay, thank you.
Yes, Suman, you are saying something?
Thank you, sir. Thank you.
Yeah, welcome, welcome. Okay, thank you, Parul.
Okay, sir. Thank you, sir. We can log out.
Now, yes.
Yes, sir.